So we've been talking quite a lot about innovation in the last hour. And innovation is going to be the topic of this short session as well. And to talk about this, I've got the pleasure to introduce Gonzalo León from the University of Madrid, who's in charge of innovation and especially the exploitation of innovation within the Human Brain Project. And he's got quite a few very interesting elements to share with us. So Gonzalo, all to you.
Thank you very much, Franz. It's a pleasure to stay here. In fact, yes, innovation is a key activity in HBP, and many of the research efforts carried out from the very beginning should be ready to be used by academical, clinical, and industrial users. And this should be part of the 10-year legacy of HBP. Then, after many years, we considered last year, in 2020, that it was the right time to increase the visibility of the innovation efforts made by many of the HBP researchers, and then to propose the creation of the Innovation Awards, a honorific recognition for them. After an initial proposal from our group at the UPM, the DIR approved the creation of this Innovation Award since this year. Just to mention the procedure, according to the current procedure, the UPM will select every 6 months 3 candidates, HBP researchers and their teams, not a single person, based on criteria such as the maturity of the technology they have developed, agreements for exploitation with the industrial sector, steps toward the creation of a spinoff, licensing of software, hardware, or know-how to external entities, the startup of clinical trials, among others more specific for each case. Then the DIR will decide by selecting one of them. We use for the selection published information for on each candidate by using open sources and also the exploitation plans submitted for consideration. Until now, 2 awards were granted. The first was awarded to Viktor Jirsa and the virtual epileptic patient, and the second one to Marcello Massimini and the perturbational complexity index. Congratulations to both researchers and their teams for their outstanding work, and also for the stimulus to other HBP researchers moving to our innovation processes. It was a great honor for us to see how innovation efforts are recognized, and we are convinced that it will be a huge step forward to demonstrate how science-driven innovation in HBP could become at the end a market success. Thank you, Franz.
Gonzalo, so I think it's time to give the word to the awardees, and Viktor, maybe we can start with you, and can you tell us a little bit more about, this Innovation Award and how you went about it, how it came together, and just tell us a little bit more.
So, first of all, thank you very much. Thank you to you, Gonzalo. It's a pleasure, and I'm happy to thank you all on behalf of the VEP team, the Virtual Epileptic Patient team. And this is a technology that has been developed during HPP. To go from invention to innovation, it takes some time. The original invention was a virtual brain, and then during HPP we applied it to epilepsy, and this became the innovation. And the virtual epileptic patient is a data-driven brain modeling technology that we are using for diagnostic mapping in epilepsy patients. So that means a better identification of the epileptogenic zone. One aspect, or multiple aspects, makes it stand out. There is a large diagnostic value to it, in the sense that we can actually diagnose how good we know the results are, the degree of confidence. Number one, this is very important. Number two is that because it's model-based, we can actually use it also independently to make simulations of an individual patient, simulate seizures, the variability of the seizures, and that opens up many other opportunities for the use of this type of technology. As I said, a team has developed it. And there I want to thank, first of all, the HPP team that has accompanied us throughout the particular process. Then my team at home in Marseille, and that's in particular Hui Fang Wang and Marmaduke Woodman, the two TBB engineers that are accompanied by many postdocs and students in the forefront, Paul, Jean Didier, Maysam that has worked on the artificial intelligence techniques to make the mapping, Giant, Borana. There are many of these wonderful people having developed the technology hand in hand with a clinical team that is absolutely conditio sine qua non. We cannot make it without them. Fabrice Bartholomé heading this team together with Julia Scholli and Maxime Guy and many others that have contributed to this. And one thing that I want to emphasize, without the support of the university and the institutions, this would not have been possible. So thank you.
Well, congratulations to you, Viktor. But there's one thing that you haven't told us yet, because I think not only are you getting an innovation award, but you're also pushing this innovation even further to patients very soon. Can you tell us a little bit more about this?
Thank you, Franz. Just innovation does not get it to the patient. If you want to go all the way to the patient, you essentially need to create a startup company or spin-off. Here it's a spin-off of the Human Brain Project. And this is what has happened a few weeks ago. In middle of August, a spin-off was created. Several of the stakeholders in the virtual brain got together, and the institutions to decided to create a spin-off company that will bring it to the market. The plans at the moment are in 2025, 2026, if everything goes well, with a minimally viable product, first targeted towards epilepsy. And then linking it to high resolution, as we already discussed here in the Human Brain Project at the summit. And that opens up the possibility to stimulation. And through the stimulation, it opens up the possibility to application to other pathologies, such as neurodegenerative diseases, Parkinson, Alzheimer, etc. So all of us are extremely excited about this.
Fantastic. Gonzalo, do you allow me to congratulate Viktor for you? In a COVID-safe way. So congratulations, Viktor. Thank you. Fantastic. Okay, great job.
Thank you.
So can you move here so that I can maybe talk to Marcello? Marcello, your turn now. And you're also an Innovation Award grantee. Can you tell us a little bit more what this covers?
Yeah, thank you, Francis. And really, thank you on behalf of the whole team. It's a large team, mainly within HPP, but also extending beyond. And well, in a few words, you know, what this technology is, it's a way of measuring brain complexity that is useful to detect consciousness in challenging clinical conditions. So we know from theoretical neuroscience, we've been talking about this even earlier, that dynamic brain complexity is a fundamental subset for consciousness. And we developed a reliable, practical way to measure it at the bedside. And this is done by stimulating the brain, engaging causal interactions within the brain, and then recording the brain reaction and zipping this response to measure the information content. It's like a radar. We ping the brain and then we measure. So over the years, mainly within HBP, we made a lot of effort to validate this, and we find that this radar works pretty well in a challenging clinical condition, including unresponsive patients, which is very important clinically, ethically. This is also being explored by Katinka and Michele Farisco, for instance, the ethical perspective. But now we're facing a new challenge, like Viktor, although we are lagging a little bit behind. We need to transform this and to transpose it from the research center to the hospital and to the rehabilitation centers. We are doing this in two parallel ways. So one is working with Nextim, a Finnish company, fantastic research and development team, and we are developing new prototypes that are optimized for clinical use. It's pretty much like turning this technique in something similar to echography, something that you can use, you know, every day. And then the second line, a parallel line, is that with the support of an American foundation, the Tiny Blue Dot Foundation, we are deploying some of these prototypes in different hospitals in Europe and beyond. So in the United States, we have MGH, Massachusetts General Hospital, Department of Neurosurgery and Psychology in UCLA, and the Department of Neurology, University of Wisconsin. And here we started a multi-centric study. It's not yet a clinical trial, but in 2 years, we plan to start the clinical trial. So this is the story, and I would like to thank people if I
Sure.
have 1 minute, because this is the great pleasure. So it's been great teamwork, and University of Milan, Silvia Casarotto, Angela Comanducci, neurologist, Mario Rosanova, and Simone Sarasso in Liège, the Coma Science Group, part of HPP, great team. Stephen Loris at the time, and at the time Melanie Boli was there, Olivia Gossry, first testing patient. Then also Giulio Tononi, University of Wisconsin, where we did the first measurements, and Nextim and the research and development people there. And then this is just the tip of an iceberg, because as we, Dalan before told the story of, this effort within HPP to look at the mechanistic aspect of this complexity that is relevant in patients. And here it's incredible, because we've been doing experiments in slices, mice. This is Mavi Sanchez-Vivets, rodents, Oslo, Johan Storm, Alessandro Arena, and intracranial in humans in the Guarda Hospital, and all this. So I think this multi-scale, multimodal approach, pure HBP style, it's unique for a clinical index, and it's helping us to understand what are the neuronal mechanisms, loss, recovery, and complexity, not only in severe brain injury, but also in stroke, which opens, the possibility of applying this technique to a much larger population. So thank you again. Looking forward to update you soon about the development.
Fantastic. Congratulations, Marcello. So let me do it the right way. Gonzalo, is there anything you want to add?
After listening to Viktor and Marcello, that was clear for everybody that here these are excellent examples of moving from science-driven to innovation in a way that we can demonstrate how the HBP can offer to solutions for people, which is exactly the type of things we need to do. We have started with these two awards, but we have more for the future. That in fact, at the end of the project, we will have the possibility to award 3 more, 2 next year in 2022 and 1 more in 2023. Then there are opportunities for additional teams to present things, and then to extend this opportunity, even to extend the opportunity for other researchers, not exclusively the people involved in as a partners in HBP as today. From our side, it's a pleasure to work with this kind of researchers, and then we offer all our support for them in order to move their results to the market, and also to convince them. Then use us in the project, and then feel free to contact us to obtain additional information, because at the end, this is our role here. And then this is the type of things that we need to see more in the future. Thank you, Viktor and Marcello, for your work. It was excellent to work with you in this process, and we are ready to continue this work for the future. And Franz, thank you very much for the session. Thank you.
Thank you very much, gentlemen. Thank you very, very much.